Welcome back. St. Lucia's response to Dominica's plight in the aftermath of Tropical Storm Erica is intensifying, with donations pouring in via the appointed relief coordinating agency, CMO. We'll hear from Director Velda Joseph in a moment. First, the storm-ravaged island is grappling with a badly battered healthcare system. The island's Chief Medical Officer, Dr. David Johnson, says while some infrastructure was left standing, the country is in dire need of pharmaceuticals. Dr. Johnson was in St. Lucia when the disaster struck.
From what I've heard, it doesn't seem that we have a lot of damages to a number of our healthcare facilities per se. Our main hospital is still operating and functioning. We have not heard any reports in terms of injuries directly to our healthcare providers, but obviously some of the families are affected, and some of them are cut off, so are not able to make it to the healthcare facilities. It is a concern to us in terms of some of our patients, well, those who are directly affected, in terms of bringing essential medication to them and ensuring that they have the essential medication, and also to take care of the wound and those who are wounded or injured, and those who are obviously emotionally stressed out at this time. You could well imagine, from what I've heard, there seem to be, where the landslide occurred, a number of families that have been affected. So it's a serious problem for us at this time.
St. Lucia's Chief Medical Officer on Saturday accompanied a team of medical practitioners to Dominica. The Ministry of Health provided a number of boxes filled with supplies.
I am taken back with me, thanks to the government and people of St. Lucia, a number of critical drugs and medical supplies which we in fact need. I was in contact, or I've been in contact with the hospital medical director of our main hospital. I got a report of a meeting which was held yesterday, and I have received a list of the essential drugs that we need, things like life-saving drugs, and St. Lucia, within a couple of hours, in fact, the Chief Medical Officer of St. Lucia, who has been basically taking care of me here in St. Lucia, has actually put with the assistance of PAHO, I've put together a donation of critical essentials.
And Dr. Johnson says a request has been sent to the Pan American Health Organization, PAHO, for at least 2 pathologists to assist with dealing with the dead. The death toll now stands at 31 and expected to rise. Some 21 people are listed as missing. Meantime, PAHO has sent in another team of specialists to assist in the needs assessment process. The team traveled to Dominica via St. Lucia.
We are going to work together with the Ministry of Health to complete the damage assessment and see what are the public health needs and the environmental health needs, and see how we can mobilize help to cover at least the immediate needs.
And as you heard, St. Lucia's response is intensifying, with nationals heeding the call. Post offices island-wide are being used as drop-off points. Velda Joseph is the director of CMO.
We have receptacles at all the post offices, so persons can deposit their canned stuff and the dried goods. And some of the other items that we have identified that are actually on the priority list from Dominica, you can go into the post offices and deposit these, and we will make arrangements to collect them from there. We have also received, I'm happy to note, calls from a number of agencies. I think the agencies have really come together, and persons are aware of the mechanism for coordinating response, and all of the agencies are actually coming to CMO to say we have persons on standby, we have technical persons that can be deployed, what is the arrangement. For us, the deployment is through CDMA. If there is an agreement between entities in Dominica and entities in St. Lucia, CDMA would then not be able to cover or be responsible for these entities. So we deploy through CDMA, and once that is done, CDMA will be responsible for everything put it into those persons there.
And several regional response teams are being routed through St. Lucia to Dominica. Teams from Antigua, Montserrat, and Barbados are on island awaiting deployment. The government of Dominica has also published a priority list for aid supplies. Among the items are heavy equipment for the clearing of debris and restoration of roads.
There are actually companies from St. Lucia that are interested in providing heavy equipment assistance to Dominica. In fact, we got a call just yesterday. We have been in touch with CDMA, and we're awaiting guidance as to how that is going to be deployed. As you rightly said, there may be specialized vessels that would be required to transport this equipment. There are other issues of liability in terms of insurance for the operator, insurance for the equipment, in terms of fueling of the equipment. So we currently are waiting CDMA to actually indicate whether we can deploy and what the arrangement is for the deployment of heavy equipment.
Canned foods, baby items, and cleaning supplies also form part of that priority list. Well, for St. Lucians, the deluge and devastation brought on by Tropical Storm Erica in Dominica came as a shock, as St. Lucia had experienced very little rain due to the storm. However, experts at the Caribbean Institute of Meteorology and Hydrology had an idea what was taking place, but they too were surprised by the images. Dr. David Farrell is the principal at the Institute.
We have a series of models that we run, both looking at wind, rain, waves, etc. And so we were working with the disaster community through SEDEMA in terms of providing updates in terms of what we anticipated Tropical Storm Erica to do. We expected that there was going to be intense rainfall over Dominica. The models were showing that that would happen. The extent of the damage on Dominica, we expected impact, but probably not the severity of impact, and certainly not the level of loss of life that occurred. But we were providing SEDEMA with and others with constant updates in terms of the fact that there was going to be severe weather and severe rainfall over Dominica.
Dr. Farrell says while the region is experiencing fewer hurricanes, the intensity of rain events is proving more catastrophic, especially given the prolonged dry period the islands have had to contend with.
Because you would have, in some cases, decreases in foliage on trees, and so more direct rainfall impacts on the ground surface and so on. Plus, you'd have reduced vegetation in some cases as well on the ground surface, which makes it easier for soil to move. But it is, as I pointed out, a fairly intense event. At some points we had very, very significant rainfall rates, which we knew we were going to have high rainfall rates, but the impact of those high rainfall rates on the land surface, we didn't expect the level of damage that we saw. We've been seeing over the years that the rain events, even associated with tropical storms or not associated with tropical storms, are causing significant impacts throughout the Eastern Caribbean and to some degree the Western Caribbean as well. We've seen, if we go back to St. Vincent in April 2011, we saw that a concentrated rainfall event in the northeast of St. Vincent produced significant damage, and that was outside the hurricane season. We saw December 2013 the impacts of significant weather on St. Lucia and on St. Vincent. And so we are recognizing that it is not necessarily the Category 1 or Category 2 or whatever that we're used to associating with significant weather events, but that you can have these significant weather events outside of the hurricane season, and you can have them inside of the hurricane season, and the wind speeds that we normally look at are not that significant, and so one should not be too complacent.
Dr. David Farrell is on his way to Dominica to assist in the restoration of Met services at the island's 2 airports, as well as instruments of the early warning system.
Rain gauges, stream level gauges, etc., and a couple of automatic weather stations. We need to make sure that those are up and functioning again. We can see some of them online. There are a couple that we can't see at the moment, but we believe that they're still there and that they just need some work done on them. And then we will work as well with the water authorities and the disaster management office to try to collect as much data as we can, and also to try to provide them with whatever technical support that we can. We will also be working with the World Bank team. The World Bank has a team of engineers there, and so we'll be looking at doing a geohazards assessment as well on Dominica with the World Bank. We have done similar types of work before. Actually, we did some work here in St. Lucia right after Tomas. We came here with the first teams really looking at the geohazard situation here and the water situation here. We did the same in St. Vincent in April 2011. We did it as well in St. Vincent in December 2013, and we've done it in a number of other islands prior to 2010 as well.